Hey everybody, it's the Mommy Monitrese, me. Today we're going to be talking about something that's very, very important and very widespread in the U.S., and that's maternal mortality, specifically for brown women and women of color. Today I want to talk about a different perspective, maybe like look at it from a different angle, because whatever we're doing now isn't working. Blaming Western medicine, blaming the doctors, blaming the hospitals. They have specific policies and standards that they have to follow that just were not created for us. Let's just be real. We are not the standard. Brown women, women of color, this is America. The standard is white women and white men. When we're in the hospital, they follow the same standards for white men and white women for us. And that's just not gonna work. We're different. Everything about us is different. Our blood is different. Our skin is different. Our body mass, muscle mass, fat, like everything is different. How can we follow the same standards if we're not the same? So what are the contributing factors? I think hormone therapy on women of childbearing age. Let's look at fibroids, PCOS, anxiety, diabetes, hypertension, obesity, medications, including hormone therapy like contraceptives that most women have been using since we've had a cycle, right? Since we were 13, since we reached puberty, to help regulate our cycles. Diabetes, 21.68 million black women in the US, and 12.7% of that have diabetes. So that's about 2 million women with diabetes, black women with diabetes in the US. 50% of that, over 50% of that is uncontrolled, meaning they're not on medication, they're not changing their diet, maybe they're not aware, or they just have a general lack of understanding of the body's natural process. 25% of women, black women, have fibroids, compared to about 6% of white women. Black women are 2 to 3 times more likely to have reoccurring fibroids or suffer from complications of these fibroids, like it eventually developing into cancer, or them growing so large that they cut off blood supplies to your other reproductive organs or other vital organs for that matter. I had a patient come in one time. For those who don't know, I'm a ER nurse, mainly in Georgia, but I've been on traveling assignments recently, and this woman was in Arizona. This was like unrelated to why she was there, but she told me that she had a male doctor check her out one time, and she found out that she had uterine fibroids. And she said the doctor's response was, "Oh, don't worry, it's normal." And I told her, I said, "Baby, that's not normal. Don't you ever let anybody tell you that a growth inside of your body, unless it's a child, is normal. It's common. Unfortunately, it's extremely common, but it's not normal." And that scared me, honestly, because I believe that a lot of doctors do approach it that way. Let's not do anything about it until we have to. Like, it's an issue now. We should do something about it now. Next up is obesity. 55% of brown women in the US are obese. And the reason that I didn't put overweight on there, because there's a difference between being overweight and obese, is because, like I said earlier, we can't follow the same standards for these these white women, because technically I'm overweight and I'm healthy. I'm about 5'9", like 160 pounds. Obesity is it's a danger to your health that you are that damn big, okay? And it stems from different traumas and different issues that we internalize as children. So next, anxiety. I know so many women who are uptight, who are high-strung, just fidgety, and can't take a deep breath and relax. I have to tell so many women who come through the ER, take a deep breath, baby, and just breathe for a little while. Your breath controls so much. If you can't get a deep breath, you can't perfuse all the way. The oxygen's not getting to every part of your body the way that it should. And that's a symptom when you aren't getting enough oxygen. You get restless, you get agitated. So just take a deep breath and talk to someone. Next up, hormone therapy. I mean contraceptives. In 2018, 65% of US women aged 15 to 49 were using a contraceptive method. But you know what is a really good contraceptive method? Abstaining. Having self-control and just not fucking. Another woman, one time, she was the mother of one of my patients, and she was about my age, so I'm 25, she was 24. And she told me that she had a elective complete hysterectomy because she couldn't stop having babies. I said, girl, you let them take your lady parts because you can't stop fucking? And she was like, yeah, it was easier. I'm gonna need us to get out of that mindset. Those hormones that we put inside of our body, you know, the shots, the pills, the implants, which I did have one, but when I got old enough to know better, I had them take it out. We don't know how vital the endocrine system is to us. And if we have external hormones coming in, fucking shit up, then we're thrown all off balance. Next up, alcoholism. I don't know too many people who don't drink to get fucked up. People drinking all the way up till they die from drinking. We're binging. It's not many of us that are suffering from alcoholism, but when we do, we binge. My man calling me. Hold up. All right, I'm back. I'm from Macon, Georgia. And back home, I noticed that people drink to escape reality. They are dealing with so much BS, so much trauma, so much anxiety, depression, that they drink to get away from dealing with reality. And, you know, fantasy is what people want, but reality is what they need. So we have to find a different way to cope, because these coping skills that we have learned are killing us. So how do we accomplish this? First, you have to change your mindset. Change your perspective also. Like, once you start, it's a cascade of shit. Like, it's not gonna stop. Once I started changing my lifestyle, I wanted to apply it to every aspect of my life. Family, my friends, or the friends that I used to have. The way that I spoke about myself, the way that I spoke about my life, the way that I interacted with people on a daily basis, you know? I romanticize my life. That's how I keep myself uplifted. You cannot let society and your environment dictate who you are. If you start with you, the person that you create in your body will have those same mindsets, those same perspectives. They will be healthier babies. A healthy woman births a healthy baby. Uncomplicated. We're going into pregnancy not ready for pregnancy. Our bodies are in distress, trying to support life when we're not ready in the first place. Alcoholism, not understanding your body, diabetes, anxiety. We're trying to have babies when we're not ready, we're not healthy. Then we're relying on a system of doctors and medical professionals who were not trained to treat us. They're trained to treat the average American woman or man, which is a white man or a white woman. All I'm saying is, take care of yourself. Queen Afua said, the woman controls the household. If you heal the woman, everybody else follows. So it starts with us. And now, I am in no way blaming any of these poor women that passed away during childbirth. You know, they placed their lives in the hands of someone who wasn't fit to take care of them. I'm blaming those who know better and don't speak up, which is myself. I try to spread as much knowledge and information as possible to make sure we are empowered to care for ourselves. We got to take responsibility, and it starts with the woman. We can do it. You can do it. But that's all for today. Thank you for watching and listening. Peace.